It's a new way of monitoring a patient's heart rate, breathing and body temperature.
Independent experts say that the system could free nurses from their routine checks, allowing them to concentrate on other tasks. The Royal College of Nursing, though, says that there isn't a substitute for having enough staff. Our health correspondent Adam Brimelow has more.
Hello, David.
Hi, Vicky.
A routine check for vital signs like temperature and heart rate. Regular updates, often every 4 hours, are a key part of care and safety in hospitals. But patients can deteriorate between these checks, putting them at risk.
Okay, so that's on
Still on
nice and securely. Yeah.
This private hospital in Brighton has been trialling a battery-powered patch that updates information on some of the vital signs every couple of minutes, issuing an alert if there's a problem. It doesn't replace routine checks, but it does ease some of the pressures.
It gives us a bit more time with patients when we know some patients do need that bit more time. Without this monitor, you're constantly thinking what's happening in the next room. I should go in there and check them. But with knowing this is on and it works well, we are able to spend that bit more time. It's just a bit more relaxing on the nursing side, knowing that your patients are being monitored.
It gives me reassurance that there's something or some equipment looking at it all the time. And I think when the nurse is with you, her mind's perhaps a bit more with you rather than thinking about what's going on in the other rooms.
This is what continuous monitoring looks like in the NHS at the moment. It's extremely expensive, very restrictive for patients, and there needs to be a nurse here the whole time to keep an eye on what's going on. With this patch, though, it's so small and light, patients can get up and move around, so they're less likely to develop complications, and that means they're likely to recover more quickly and go home sooner, saving on the costs of care.
You've had this before, so you sort of know what we're doing with it, don't you?
This British-designed patch lasts 5 days, long enough for most hospital stays. It's being developed to provide more information on blood pressure and oxygen levels. Independent experts say it has great potential for a lot of different settings.
This could certainly have a use in the emergency department and from the emergency care phase right through the first couple of days in hospital when the patient is more liable to deteriorate. It also has potentially an application for looking after patients in their own home because we could observe them remotely rather than observing them in hospital.
The patches are about to be tried out in the NHS. The company says it's in talks with 20 trusts. The Royal College of Nursing says anything that helps pick up deterioration early has to be a good thing. But it says it's still vital to ensure there are enough staff with the right skills on every ward. Adam Brimelow, BBC News, Brighton.
We're joined now by Jan Sensier, the Chief Executive of Healthwatch Staffordshire. This is an organisation which monitors health and social care. So you look out for how patients are being treated.
Absolutely, we're there to represent the needs of patients and service users in health and social care.
OK, so what do you think of this patch?
I think it's a very interesting idea, and I think it's something that could potentially be really beneficial to patients. It obviously needs trialling more, and it obviously needs patient involvement in how it's trialled. It's very important to work with patients when in hospital, but if it frees up nurse time to do more of the very important job of caring for patients, then it could be very interesting.
What are your concerns?
I guess one of the concerns will be how reliable is the technology. If it starts throwing up alerts that then don't actually turn out to be true, is it going to get to be one of those machines where it cries wolf and people are going to be running to the bleep every time and then not actually taking notice of it when it's real? And it cannot in any way, shape or form replace the human touch. It really must be used as an added benefit.
This is the concern, isn't it, that patients are not having that interaction with nurses, and often it's other ailments or concerns that come out when you have that
Absolutely. It's really important that nurses and all medical staff are able to listen to patients. Patients often know best about what their needs are, so it's important to find that time. If this device and other technologies like it can help to free up time to listen to patients, I think that can be very beneficial.
So you'd be in favour of the patch as long as there's still that checking up. So
Absolutely.
don't just have the patch go away.
Yes, and clearly the technology needs proper testing, and I am not a medic myself. That needs to be properly trialled, and it needs patient involvement in that trialling. But what we do think in Healthwatch is that it's very important that patients have that involvement, and it's very important that nurses have the time to care for patients, and this could help with that.
Do you think generally there is a move towards technology? Technology is a good thing in medicine, isn't it?
It is.
But I'm guessing from what you're saying, you are concerned that there is a move towards technology taking over from, but if you like, the central issues of basic nursing care.
I think it's really important, as budgets are very tight. It's very important that we harness technology for the best use of patients, but it's really important to involve patients in how that's taken forward. So I'm not raising up any red flags at this point. I'm just saying that it's really important that these things are properly trialled, properly tried out, and with patient involvement.
This would free up hospital beds, though, as well, wouldn't it?
Potentially. I understand that from the early trial that it has resulted in some early discharge. That could free up hospital beds. It could, as the piece said before, allow people to care for themselves at home better. And it's very important that we try and bring care closer to home. So I think it has real potential. It just needs introducing properly.
OK, Jan, thank you very much for joining us. Jan Sensier, there, Chief Executive of Healthwatch Staffordshire. Thank you.
Let's see, time now is 8:26. BBC News Channel, of course, will keep you up to date with any developments.